I am going to review the pre-op instructions that anyone having joint replacement surgery needs to follow, unless directed differently by your surgeon or their physician assistant, to prevent having your procedure canceled the day of surgery. At your history and physical visit prior to your surgery, you will be given 2 containers of Mend. This is a nutritional supplement that aids in tissue repair. You will take 2 scoops twice a day for 1 week before and for 2 weeks after surgery. This can be added to any type of liquid, smoothie, or yogurt that you would like. You will also have a prescription for Mupirocin ointment sent to your pharmacy. This is an antibiotic ointment that you will put into your nose twice or 3 times a day as instructed by your surgeon for the 5 days before surgery. You will also be given chlorhexidine wash. This is a surgical scrub to be used 4 days before surgery and the morning of surgery, regardless of what time you are instructed to arrive at the hospital. You should always wash your hair with your regular shampoo and use regular soap on your face and genitals. Then use this special scrub from your neck to your toes, front and back, to include your armpits, the creases where your thighs meet your abdomen, and on your buttocks. Make sure to shut off the shower water and leave it on your skin for 3 minutes, then rinse it off well. Make sure to use fresh washcloths and towels with each shower. We will ask you to have nothing solid to eat after midnight the night before surgery. However, you can have clear liquids, such as water or plain black coffee or tea, up until 2 hours prior to the time you're to arrive at the hospital. You will need to stop taking any full-strength aspirin unless ordered by your primary care physician or cardiologist. Any aspirin-containing products, such as Advil, Aleve, or ibuprofen, any vitamins and herbal supplements for 7 to 10 days preoperatively. Your surgeon will tell you if you need to see your dentist to get dental clearance preoperatively. Also, he will tell you if you need any other type of medical clearances from your PCP, cardiologist, or any other doctor whose care you may be under. It is important to get these appointments for clearances scheduled as soon as possible to prevent the possibility of your joint replacement surgery needing to be postponed and rescheduled for a later date. If you have any questions about any of these instructions, please feel free to call your surgeon's office for clarification.